Performing heart surgery is a complex procedure that requires a highly skilled surgical team and specialized equipment. The following is a step-by-step overview of a typical open heart surgery, specifically coronary artery bypass grafting, CABG. It is important to note that this description is a simplified version and may not cover every variation or detail of the procedure. Preoperative preparation. 1. The patient is admitted to the hospital and prepared for surgery. 1. This involves cleaning the surgical site, administering anesthesia, and ensuring the patient's vital signs are stable. 2. Intravenous, IV, lines are inserted to provide fluids and medications during the procedure. 3. The patient is connected to various monitors to track heart rate, blood pressure, oxygen levels, and other vital signs. 4. A urinary catheter may be inserted to drain urine during the surgery. Sternotomy. 1. A vertical incision is made in the center of the chest, from the top of the breastbone, sternum, to just below the level of the heart. 2. The sternum is then divided, and a retractor is placed to hold the chest open and expose the heart. Cardiopulmonary bypass, CPB, setup. 1. The surgeon places tubes, cannulas, into large blood vessels to redirect blood flow away from the heart. 2. A cannula is inserted into the aorta, the main artery carrying oxygenated blood from the heart to the body, and connected to a bypass machine. 3. Another cannula is inserted into the right atrium of the heart to drain deoxygenated blood to the bypass machine. 4. Heparin, an anticoagulant, is administered to prevent blood clotting during the bypass. Cardiopulmonary bypass, CPB. 1. Once the bypass machine is activated, it takes over the function of the heart and lungs. 2. The bypass machine pumps oxygenated blood to supply the body's organs while the heart is stopped. Cardiac arrest. 1. A solution is infused into the heart's arteries to induce cardiac arrest, temporarily stopping the heart's pumping action. 2. This allows the surgeon to operate on a still heart and create a bloodless surgical field. Graft harvesting. 1. The surgeon removes a section of healthy blood vessel, graft, from another part of the body, commonly the chest wall or leg. 2. Typically, one end of the graft is left attached to its original blood supply, while the other end is prepared for bypassing the blocked coronary artery. Graft placement. 1. The surgeon carefully sews one end of the graft to the aorta and the other end to a coronary artery beyond the blockage. 2. This bypasses the blocked or narrowed segment, allowing blood to flow around it and reach the heart muscle. Multiple grafts, if needed. 1. Steps 6 and the 7th may be repeated to bypass multiple blocked coronary arteries. De-airing and restarting the heart. 1. Once the grafts are in place, the surgeon removes any air bubbles from the heart and blood vessels. 2. The heart is then rewarmed, and blood flow is gradually restored to it. Closing the chest. 1. The sternum is reapproximated using wires, and the layers of tissue and skin are closed with sutures or staples. 2. A sterile dressing is applied to the incision site, and temporary drainage tubes may be inserted to remove excess fluids. 1. Postoperative care. 1. The patient is transferred to the intensive care unit, ICU, or a specialized cardiac care unit for close monitoring. 2. Medications, such as pain relievers and antibiotics, are administered as needed. 3. Ventilator support may be provided until the patient can breathe independently. 4. Gradually, the patient is weaned off the bypass machine and other life-supporting measures. It is crucial to understand that heart surgery procedures can vary depending on the patient's specific condition and the surgical technique chosen by the medical team. The steps described here provide a general outline, and it is always essential to consult with qualified healthcare professionals for accurate and detailed information regarding specific surgical procedures.